Hi guys, my name is Esther and I used to have fibroids, but now I don't have fibroids. So guys, I have been trying to film this video for over a week. I've recorded it like 3 times, and either there was always a time that the file was corrupt or it was blurry or something like that. I'm over it. But I thought, let me just try again. If this doesn't work out, I'm gonna start throwing plates. But yeah, guys, my name is Esther. I am 31 years old and I had fibroids, and I no longer have fibroids, or the fibroids that were causing the issue are no longer causing issues anymore. We thank God. And just so you know, people that are watching this, the reason I'm making this video is because my periods were very heavy, causing a lot of issues, whether it be socially, whether it be mentally, whether it be physically, whatever. They were causing so many issues. They were 8 days long. My periods were either 7 or 8 days pre-surgery. Now they are 4 days. My periods are now 4 days post-surgery. So if this video can help somebody make decisions about what they want to do with their fibroids or X, Y, and Z, I want to be the one to help you, because I don't think there's enough information out there about the experience in the UK. I've seen many people in America make videos and whatnot about their healthcare system and the route they took. But again, I don't live in the US. We have a completely different system over here. So I thought, let me try and be helpful and really talk about my experience. And if you were on the fence about it before, you didn't know that this was possible before, I hope this video helps you. If you've had this experience before as well, maybe there's similarities or differences in my experience, but I thought, let me do this. Hopefully I don't go on for too long, because it was a very long process, but let go. As I said, I had fibroids. Now, fibroids are non-cancerous growths that grow in and around the womb. They can vary in size, they're not cancerous or anything like that, but they can cause issues for those who have wombs. Some don't get any symptoms at all. Some get so many symptoms. I mean, there's so many things that can happen regarding, sex organs, to be fair. So, this is just one of them. And I'm going to quickly go from the beginning. So I'm 31 now, but I started my periods when I was 12 years old. I was at 12? Yeah, I was in year 8. I think I must have been in year 8. And my period started, and from 12, they've always been heavy. Always been heavy. And those times I was just using sanitary towels as well. So it just wasn't a good experience growing up. It was very, very heavy. It was crampy, X, Y, and Z. It was very clotty as well. Those who have periods will know what I mean by clots. It was just awful. It was so painful. And again, it was 7 days, 8 days. But I thought that was normal, because my mum, I think she said as well that her periods were like almost a week. They were heavy as well. So I just thought it was normal. It's not until I was in science class, I'll never forget Miss Petanutso in year 9, I think it was. I can't remember what year it was. And we were talking about reproduction, X, Y, and Z. And she said that, it's on average, periods are about, the blood that comes out is about an egg cup of blood. And an egg cup is basically like, do you know those eggs that you eat that you cut the top of? Is it Soldiers? I can't remember what type of egg it is. I'm not an egg person, but I know people use that for the egg that you cut the top off and you dip like bread in it and stuff. She was like, that's the average amount that comes out during your period. And I thought, well, someone's lying, because that to me is probably like half a day, if that. And I thought, that can't be right. But then she said, this say average. I thought, okay, maybe I'm just not the average. I'm just above the average. And, asking other people, I went to an all-girls school, so all of us were having periods. Some of my friends was like, oh, my period is 3 days. And I thought, I know you motherfucking lying. I'm sorry to swear. But I was like, then why is mine 8 days? I just didn't understand it. And it really came to a head when I was 16. I remember I was 16 because I was what's that? I was revising for my GCSE exams at the time, and I felt so dizzy. Like, this was more than I just feel lightheaded. This was, I could literally collapse on the floor right now. So I thought, let me go and get some fresh air. I was in Stratford Library, went to go and get some fresh air, and I was on Stratford Broadway, and literally the floor felt like it was here. The floor felt like it was here. I was ready to collapse. But anyone that is from Newham, anyone that's been to Stratford Broadway, that is not a place that you need to be falling down at. So I was like, let me just make my way back to the library at least. And literally I got into the library and I just collapsed on the floor. Like, I had zero energy. And they took me to the ambulance took me to the hospital. I did tests, and I happened to be on my period at that time. And they did tests, and they told me, you are anemic. And my understanding of anemia is you've got a low iron count in your body, and obviously you need iron in your body, you know, all the hemoglobin stuff and all that jazz. Again, actually, I haven't said this first. I'm not a doctor. I'm not a medical professional. So there's going to be some phrases, some terms that I'm using that probably is not correct, or X, Y, and Z. If I say something wrong, please correct me nicely. But yeah, I you know, my iron levels were really low, so they gave me medication and things like that, and it was basically because of my period, you know. So a lot of people that have heavy periods do have anemia as well, you know. And people think it's just oh yeah, you're tired all the time, but just imagine being tired all the time. It's not easy. And then you're on your period as well, and it's being caused by something that you can't control. Like, that has to happen. It just wasn't a good thing. So from the age of about, I would say, uni time, so I was 18, I was constantly, at least once a year, I was going to, like, my doctor. I would speak to the family planning nurse, all these things, and just saying that my period is just too much. Like, it's ruining my life ultimately, you know. And you know what doctors do in this UK, they will give you contraceptives or offer you contraceptives to help manage the period. So either to make the periods a bit lighter, or give you medication, not just contraceptives, but medication to maybe reduce your bleeding, or to help stop your periods at all. So I've probably been on so many different types of contraceptive methods, you know, hormonal and non-hormonal as well. And the period is still 7 days. Like, it might be a bit lighter. It was a little bit lighter, but it was still 7 days. And I was like, I'm just over this. Like, this is just some bull. This is some bull. It got to the point where I was having, like, I was going to doctors. They were referring me to, like, specialists, referring me to ultrasounds. And they were like, oh, it's normal. It's going to settle. It's going to settle. And I'm like, at this point, I think I was like towards my mid to late 20s. And I was like, I've had a period now for over 10 years. It ain't settled. So is it another 10, 20 years that is going to settle? I was like, I can't do this for another 10, 20 years. And I was just over it. Like, it got to the point where I didn't want to have my period. So, for example, I've been on the pill on and off, like, for a lot of my adult life. Sometimes I just take the pills back to back. I don't know if that is good or bad, but it got to the point where I didn't want to have a period. You know, let's just say you have 12 periods in a year, each month. I probably was having like 6, maybe 5 or depending on the amount of packs I took back to back, because I wanted to avoid my period at all costs. Like, you will never really know how a period can affect your life until you experience it yourself, and you're getting these cramps, you're getting these pains. Or, you know, for me, I was doubling up on my sanitary stuff. So there's no way I could go to sleep and not put on a tampon and a sanitary towel. There's no way, because by the time I would wake up in the morning, there'll be blood all over the bed. That's not sexy. I mean, it's not bad. It's a natural thing, but you know, you're getting to the age now, maybe you're doing sleepovers, wink, wink. You can't do that on your period. Like, it's one of those things. I'm thinking, how am I when I'm in my marital bed, and you know, I'm sharing a bed with someone, and I'm waking up in the morning and the bed is bleeding. Like, the bed is bleeding. Like, there's blood on the bed, and it's just so inconvenient. So I think when I was about 27, I had a scan. I had an ultrasound scan, and it revealed that I had fibroids, which is probably causing the heavy periods. Because again, fibroids they're not cancerous, you know, they don't necessarily cause you harm in that sense, but they can be very disruptive, I would say. They can cause a lot of issue. They can cause cramping. They can cause heavy periods. They can cause longer periods. All these things. So they said you've got fibroids that are about 2 centimeters. You got about 2 centimeters in size, which is about like that, I think. Yeah, about 2 centimeters. And I was like, okay, at least I know the cause of it. But I wasn't offered any remedy. It was kind of just, you know, it's gonna settle. I've heard this so many times, guys. I don't think you understand. Like, I'm sure the people watching this that know what I'm going through, they will be able to tell you as well. So, we get now to this is just before the pandemic. I think it's the summer before the pandemic. Yeah. Or just no, because the pandemic started really like in the beginning of 2020, right? So I think at the end of 2019, I asked to have another scan because the periods was just still trying to ruin my life, just trying to kill me. And I had another scan. I think I even had 2 scans, and it came back that my fibroids now were 5 centimeters in diameter. So in the space of maybe 4 years, or just under 4 years, it's my fibroids have like doubled in size, even more, it tripled in size, almost tripled in size, in fact. At this point, I'm like, you're taking a piss, because people have fibroids that can grow up to the size of like a watermelon or something. You literally have people that look full-term pregnant, and it's not a baby in there, it's a fibroid. And I was like, so what, by the time I reach 40, is my fibroid going to be 10 centimeters, 20 centimeters? I was just like, no. So I spoke to the consultant, and bear in mind, this was it during COVID times? Yeah, so it was in, let's just say about April, May of 2020. So we're already in like lockdown era, so everything was being done over the phone. So I spoke to a consultant, and the consultant was like, okay, I'm going to refer you for abdominal myomectomy. And I was like, what's that? And he was like, oh, it's surgery, and they're going to cut on your bikini line to take out the fibroids, basically. And I was like, oh, like I was taken aback, because that was the first time that someone had offered, like, you know, to remove them. And I not that I didn't know that fibroids could be removed, because I do know people that have got fibroid removal. So I just thought, okay, do you know what? Whatever you say, anything to get rid of this nonsense, I'm here for. And again, because it was COVID, it was, they said that we'll put you on the list, but we don't know when you're going to have the surgery, because we're not doing any elective surgeries right now. So I knew that I could be waiting up to a year, but I'm thinking we've been waiting almost 20 years, I can wait a little longer. And after that call, you know, because he didn't really he explained like they cut your bikini line, but he didn't really explain what it was, like the type of surgery it was. So I went on Google after the call, good old NHS, not giving you all the information. I went on to Google and Googled abdominal myomectomy. And a myomectomy is basically meaning like a surgery to remove fibroids. And I was like, looks like a C-section. This is not a small play type of surgery. This is a real surgery. I'm seeing recovery, it takes about 6 to 8 weeks. I was like, Like, I think the doctor could have given me a heads up that this was a serious thing. Like, it's a major surgery. In looking at that, I saw that there were other procedures for fibroid removal. So you had one that was only very, very not as invasive, that you would probably only need like maybe a week off. You can go home the same day. There was some that maybe you're off for like 2 weeks. You could go home after, like the day after, you know, in the hospital. You know, there's one that is, you know, they take it out via the vagina, that they go, you know, up the vagina, depending on the location, the size and everything. It depends what surgery that they think is suitable. So my one, because of the location, I think mine was at the top, towards like the top of my uterus. 2 big ones, and at that point they were like 5-6 centimeters. So they were like the most effective way is, again, I'm not a doctor, this is what my doctors told me. If you're a doctor and watching this thinking, oh, they could have done it this way, they didn't. Okay, this is the way they did it. Okay. So I was like, okay, cool. So when it got to December of 2020, again, I still hadn't got a call for this surgery. So I called them up and they were like, we're starting doing elective surgeries soon. So someone's going to call you in the next couple of weeks, which they did. And they said, come for a pre-assessment. So this was January of 2020. No, wait, let me go back. This happened, sorry. I had the scan in 2020. I had the consultation with the consultant in 2021. In like May of 2021, and then at the end of 2021 they said they're going to start doing surgeries again. So the beginning of 2022 they called me for a pre-assessment. Now I've had surgery before. It was emergency surgeries though. So I've been put on an anesthetic, so I kind of know, like, in terms of hospital stay and things like that, I've had that experience before, but I've never had an operation that was not emergency. So it was a whole process of things. So pre-assessment, I thought I'm going to go to this pre-assessment, they're going to give me a date of the surgery. Nope, that didn't happen. That didn't happen. I did the pre-assessment, they took blood, they swabbed my groin, they what else did they do? They were asking me questions about, like, my medical history, X, Y, and Z. Do I smoke? Do I drink? X, Y, and Z, blah, blah, blah. The usual stuff. And about a week later, they called me and said, your iron levels are very low. I mean, I've known that. I've known that since I was 16, that my iron levels are low. So they're like, you have to have an iron transfusion before you can have the surgery. Because I think if your iron is like really low and you have a surgery like this, it can take you long to recover. That's how it was explained to me. So I was like, okay, cool. So what happened? Yeah. So I had they booked me in for a transfusion. I had to sit in a chair for about 2 hours, and iron was basically fed through my veins. I just had to sit there for 2 hours, and I was like, okay, so now I've had this, I can have my surgery. Nope. Called me again. You need to have an injection before the surgery, about a month before this, at least like a month or something before the surgery. I was like, injection for what? They didn't really explain it. All these things, they were just telling me to come, but because I was like, you know what, you're the experts, you're the medical professionals, let me just go. I had no idea what this injection was about. I thought it was going to be an in and out thing. I went to the hospital now. They're booking me in as a patient on the ward. Like, I had my own bed and everything. And a consultant had to come and see me, and then the consultant then had to prescribe a medication. The pharmacist had to come and see me, and then after like 7 hours being in the hospital, remember, I just thought I was going to be there for like an hour max. I got there like 10, and I didn't have this injection until about 5 o'clock. Good old NHS. But yeah, and it was literally an injection in my abdomen. And it's basically to reduce the size of the fibroids pre-surgery. Obviously, the smaller the fibroids are, the easier I believe the surgery will be. So I had that in. But again, I didn't feel like they were telling me anything. I had to, like, they showed me the medication and they gave me the leaflet for the medication. But should you not have given me that before? I don't know. I was just like, you could have given me that before, but anyway, that's all good. So I had that. I went home now. I thought, okay, now I'm going to get my date for the surgery. No. They called me now again. Your MRSA positive, which I think is a virus or something that lives on a bacteria that lives on your skin. And I assume, like, when you're having surgery, because I think there wasn't like a actual problem. Like, a lot of people were dying and stuff from being MRSA positive. I could be wrong, but I'm sure I've read somewhere that was happening. Or maybe that was Grey's Anatomy I was watching. Remember when Miranda was like, she had MRSA, and a lot of her patients were dying, and she didn't realize she had. Anyway, that's a TV show. But again, they had to prescribe me this bath oil or bath liquid or something that I had to use for 5 days every time I had a shower, and I had to put ointment in my nose for 5 days as well. And they told me I have to do that when I get the date for the surgery. I have to do that for another like 5 days or so before the surgery. So I get another call now, and thank God they've given me a date for the surgery, which was the first week of March of 2022. You know, I think they called me in February. So it was, you know what, it wasn't an issue getting ready for everything, because I've got very supportive friends. So I had my friends, you know, make me little hospitals bags, like with really thick pads. So yeah, so they gave me a date, and then I had to have a COVID test 2 days before. So they told me if you're COVID positive, you can't have the surgery either. So that added like a level of, oh, just imagine, I've done all these things, I've waited for over a year for this surgery, it's happening now, and I can't have it because of flipping COVID. But I didn't have COVID, so everything was to go ahead, and I had to be at the hospital for 7 a.m. that day, and I had to be nil by mouth, which basically means I couldn't eat anything or drink anything. I think I couldn't eat anything from like 2 a.m. that day, and I couldn't drink anything from like 6 a.m. that day. So I was like, oh my gosh, this is really happening. Oh my gosh, I'm gonna have the surgery. And I was quite excited because I'd suffered for so long, and it was finally like, you know. And with my work as well, I mean, my job, I could have all that time off and I'm still going to get put full pay. So I was like, I'm going to make sure I'm not stepping back at work until I am 100% recovered. And they said 6 to 8 weeks. So my work knew that I could be off potentially for 2 months. That wasn't an issue. But I know some people, if they're self-employed or they're contracting or X, Y, and Z, they might not be able to take that amount off. So the day of the surgery, you know, I get there, you know, I make sure I'm there on time. I don't want any issue. I don't want them to say, oh, you've been late, we're going to cancel the surgery or anything. I got there was other women there, other black women, might I add. I'm sure, I think everyone knows that fibroids, you know, affects women of color, black women, more than it does white men. And I don't think I've ever met anyone, white women, that have fibroids. But I know they do get them though, but it's a lot of black women get it. All of us were black on the ward. There was about 5 of us having surgery that day, and they were going to literally do it like one by one, you know. And I can't fault the hospital because everything was organized. So all of us got that at the same time. You had the consultant going to each and every one of us. You had the anaesthetist going to us as well individually. You know, you had the nurses going to do, you know, set us up, you know, taking our observations and things like that. You know, I can't fault them. Everything went smoothly, you know. And when it hit me that this is something serious. This is not up for play. This is not I'm taking out my tooth at the dentist. This is a serious surgery. When the consultant came to me and she was like, you know, we want you to sign this form, basically saying that if basically your life is at risk, like there's a risk to life during the surgery, you're losing a lot of blood or X, Y, and Z, we'll remove your uterus. We can give you a hysterectomy. I said, what? I said, what? What? It's a bit drastic, a bit dramatic. But then I guess it's like, okay, if your life is at risk, do you want to die or do you want to have a uterus? I'd rather not die. God, Ọlọ́run má jẹ́, God forbid, I'm not going to die today, okay? I still got things to do, okay? So they came and they took me to the theatre room, the anaesthetists, the people that were going to put me to sleep. Lovely. They were answering my questions. They were putting me at ease. And the next thing I remember, that's the last thing I remember. The next thing I remember now, I'm seeing blue. All I can see is blue. And I'm like, what's going on? And the blue is because the paint from the room was blue. And I was like, oh my gosh, where am I? And I see a lady sitting by my bed doing something. And I turn my head up to the sky and I have to cough. So I coughed. And let me tell you, that was the most painful cough I have ever experienced in my life. The most painful cough I've experienced in the life that I'm living now. And I just burst into tears. The lady that was next to me was a nurse, And she was like, it's okay, it's okay. I was like, where am I? She was like, you're in the recovery room, just calm down. I'm just giving you medication. I'm just giving you, what's the thing, painkillers. You're gonna feel better soon. Oh my gosh, I can't explain it. That pain was something. And I remember feeling that something was in between my legs. I was like, what's going on? I looked to the side and I'm seeing a catheter. And literally a catheter is like a tube, a long tube they put through, you know, where you go to pee. And it's attached to like a pouch. So instead of you needing to go to the toilet, getting up to go to the toilet, because I flipping couldn't get up to go to any, I couldn't even turn to the side, let alone get up to use the toilet. The urine is captured there, so that you don't need to go to the toilet. And because I've been nil by mouth for basically over 12 hours or so, however long, you know, I didn't need to do number 2 either. So I was not getting up to go to the toilet. They took me back down to the ward. All of us were just in bed like this, like we were either sleeping or everything. You're just hearing, well, that's all you can hear, because that pain, I'm not gonna lie to you, it's painful. Just like any surgery, just like if you take out your tooth. I've had my tooth taken out before. I've had 2 teeth taken out before. It hurts. It hurts. The painkillers they were giving though, it was helping. I'm not gonna lie. I understand now why people get addicted to pain medication, because that morphine was hitting. It was hitting. You don't realize how much you use your abdominal muscles for. How many things you use your abdominal muscles for? To cough, to laugh, to sneeze, to cry. You feel it in your abdomen. Oh my gosh, it was awful. I'm not gonna lie. So I think it was the second day I was in the hospital. So I think I had the surgery on Tuesday. By Thursday or Wednesday, I think it was the day after, you know, I saw the women next to me getting up to go to the toilet or getting up to like freshen up. So I thought, yeah, me too. Let me go freshen up. Let's just say it ended up in tears. I started bawling because I tried to do too much too soon. I tried to have like a proper wash, brush my teeth, everything. I couldn't even stand up properly. Where you sent me? And I just started crying, and the nurse had to come and get me. It was just so embarrassing. Like, I was like, what have I put myself into? And they even gave me a frame to use as well. They gave me a frame to use because obviously like it was so painful to walk. And I think they'd taken the catheter out. So I needed to go to the toilet. And let me just say the pee, yeah. Okay, the other thing you need the abdominal muscles to do as well is to use the toilet. That pee, it was a deadly day. Let's just say, oh my gosh. It was a deadly day. And I remember thinking to myself, wait, so women that have C-sections, is this what they have to go through? And then on top of that, well, not just women, but, you know, anyone that has a C-section that has to take care of a baby as well. And I thought, it just gave me even a newfound respect for people that have C-sections, because, bruh, I said, I can't do that. I can't go through this again. The physio came to see us as well individually. She saw I had the frame. She said, why do you have the frame? I said, because I couldn't walk to the toilet without support. She said, you could walk before. I don't want you to use the frame. I don't want you to like delay your recovery. Don't use the frame. I don't want to see the frame anymore. She took the frame away. And then she gave me a leaflet, and she explained the leaflet, and she explained like the exercises that when I start feeling better, what I should do, you know, to tighten up my pelvic walls and all that area, you know, that stuff. And she also told me, you know, don't have sex. She said you can't have sex for about 6 weeks. You can't drive for about 6 weeks. I mean, this is another thing I want to say. People that are sexually active, there's no way. I mean, you're not even going to be in the mood to be doing anything sexual, to be fair. But if you do, they advise you to, in the leaflet, they said mutual stimulation, which I assume mainly means masturbation or something, or basically anything that's not penetrative, basically, I think you're allowed to do. But even then, like, it can take a lot out of you. So she just advised don't have sex, basically. So just make sure you've shagged all through the week before, if you can, because you ain't gonna be having sex for a while. You know, the consultants came and saw us individually, just explained how the surgery went, and, you know, X, Y, and Z. And the lady next to me, apparently her fibroid was like the size of a basketball. And I said, yay. I just thought, wow, like, do you know when you just think the human body, like the stuff that goes on inside, you don't know. It was mad. And you know, but when it came to me, they told me we took out 11 fibroids. I was shocked because I thought I only had 2. They told me I had 2 fibroids. And they said we took out 11, and they were like 2 of them were blocking one of your fallopian tubes. That is when I thought, okay, this is why I had the surgery. Because as much as people have fibroids and they can conceive, they don't have any issues, we're not going to act like growths in your womb might not affect your fertility in some way, you know. So I just thought, just imagine I was trying to conceive and I wasn't getting pregnant or X, Y, and Z, and I don't know. And I even thought back to, like, you know, the times that I thought maybe I've slipped up that month, is my period coming? And it always came. You know, I haven't had children, so when they told me they took out 11, 2 of them were blocking my fallopian tubes, I was like, thank you, God. Like, I was so happy. I was in pain, but I was happy. I think it was maybe 4 days after I came out of the hospital. Again, I'm still in pain. I'm still taking my medications. They've given me iron to take because my iron was low, and I think I lost blood during the operation. They've given me injections to take, blood thinning injections to take for about 2 weeks. So I had to insert, they taught me how to do it in the hospital, but I literally had to inject myself every day. And I was like, anything you want me to do, I'm going to do it. Because when it comes to your health, I don't play. I do not play when it comes to my health. And then 4 days after I got home, so this was probably like the following Tuesday or something like that. Why is my period starting, please? I was like, I know you lying. I know you're lying. At first I thought maybe it was just like residue or something from the operation, because I didn't really bleed that much. Like, my friend had bought me really thick sanitary towels, and the thing is, in the UK they don't really sell these like really thick ones, but if you buy maternity pads, they're basically the same thing. Very, very thick sanitary towels. They said no sex, but they also said I can't use any tampons. Anything that was entering my vagina, they said no. So I had to have that period with sanitary towels, and I haven't done that since I was like 15. So it was it was painful because I literally had a scar. I had stitches that were still healing on my abdomen, and I couldn't really shower as well because they said, you know, avoid that area when you are bathing or showering. So I just felt really icky as well. Like, I couldn't really shower the way I wanted to shower because of the stitching, and now I'm on my period as well. I just felt really ugh. But the period itself was about, I would say about 6 days. 6-7 days. So I thought, okay, well, this hasn't really changed anything. But I thought I couldn't really judge it because I'm having it while I'm still rehabbing. When I was in the hospital, the doctor said, because you're of your age and your body weight X, Y, and Z, you should recover quite quickly. Probably by like week 4, you'll feel much better. So when I did have my next period, she was right. I did feel better, and my period was 4 days. 4 days. And I remember thinking, oh my gosh, is this a fluke? Is this a fluke? That's another reason why I waited for a while to do this video, because I wanted to see how my periods were. So the first period happened, it was about 6 days. The second period, 4 days, I thought, is it a fluke? Had another period, 4 days. It's not a fluke. And the third period, I think I've had like 4 periods now since the operation. And only the one that I had just after was about 6 days. Everything else has been 4 days. Maybe 5 if it goes into the next day when you have a little bit of spotting, but that's it. This is just my experience. Doesn't mean if you have the surgery, your periods are going to go or get better. I honestly don't know. But honestly, I could cry right now because I just feel like I've been suffering since I was 12. And now I'm 31. And it's only now that I can say I'm happy about my periods. It's honestly such a freeing experience. And if I can make anybody else consider getting the surgery, again, not all the surgeries are the same. Some surgeries have less recovery time. Some surgeries are less evasive X, Y, and Z. You know, everyone is different. Everyone's going to get different results, but this is my results. Quickly, just before I go, talking about sex, they told me not to have sex. They told me not to drive. I think I was driving by like week 3 because my family came around, so I had to see them. I can't not see them. But I will say though, I was very, very tired after like going out. I wasn't going out like for the whole day. It would literally be a couple hours, but I remember feeling very, very tired. So guys, make sure you rest. If you do have this surgery, make sure you rest. Rest is your friend. Don't try and do X, Y, and Z. Don't try and be like, oh, let me go quickly see this person. Anyone that wants to come and see you, they can come to you. If you've got that time off, you're allowed to have that time off. Please take it off, because your body, you know, needs time to recover, you know. And in regards to sex, I had sex like week 4, which they told me it was too early, but I thought it was going to be uncomfortable or painful. It wasn't. It really wasn't. I think by that time, my actual scar, the stitches, like it healed. That part of it had healed. I'm still feeling a bit achy here and there, but nothing compared to like when I first had the operation. And yeah, I think I was just more tired after, but everything else was normal. Driving as well, I think I was okay with driving. It would just get a bit sore. But the reason they say don't drive is if you need to like brake, you know, a hard brake, obviously you're gonna, you know, go forward, or you're gonna think it's gonna aggravate your abdomen, and you know they don't want that to happen. Oh yeah, they said that if I was trying to conceive, which I'm not at the moment, they said wait about 6 months, like, because your uterus takes longer to heal than like the outside scarring. So the actual scarring and things like that can take about, let's just say, up to 2 months. But your actual uterus, all the stitching and all that stuff they've done, it can take about 6 months. So they said don't try and conceive. And they also said as well that you know, people that have this type of surgery, usually they say that when it's time for you to have a baby, when you know you're about to deliver, that you should do a C-section, because if you do it vaginally and you're pushing, you could tear your uterus. And I thought, oh, so I have to do this again. I thought, I was like, no. But the consultant actually said, no, you should be fine. You should be able to have a baby naturally. You know, obviously that's not easy. It's not easy way to have a baby either, but you know, I was like, okay, thank God. I think that's it. If you guys have any questions or anything that you're not sure about, please let me know. This is a long video, but I want it to be as detailed as possible, because you know, people are not going to be honest with you, and you're not going to meet people. Not everyone is, you know, likes talking about when it comes to their sex organs. And some people act like it's a bad thing. Like they don't even want to tell people they're on their period or show that they're on their period, because, you know, in some cultures, some societies, it's seen as a, you know, you're unclean, it's a taboo or whatnot. You know, some people are embarrassed about things like this, and I don't want it to be a thing, because just like people take care of their heart, just like people can take care of their gut, their stomach, their eye, their brain, whatever, why is your sex organ any different? If there's something wrong with it, wouldn't you want to, you know, make it better? Guys, if you've got any questions, please holler at me, let me know. If you want to share your experiences with me, if something was the same, if something was different, if you're thinking about it. Again, from 12, I've been suffering with this, and now I'm 31. So it's a long process, and I had to keep on going to the doctors. But don't get discouraged. Keep on going to the doctor. Keep on crying. If you have to go there and cry every week until they take you seriously, because some people don't even know that this operation is available. Yeah, guys. Thank you for listening to my story. I hope it's helped somebody. And yeah, hopefully, if I ever do a video, the next video will be me up the duff, talking about my experience of trying to conceive post fibroid surgery. But yeah, bye guys.